I want to talk a little bit about, because I'm very familiar with using this to improve your motor skills, like balance training, certain movement coordination, even strength benefits. We wear them, do the task, take them off, like you said. And then after that, your brain is able to process all of the information at a much quicker rate, we see, and you see the improvement. You feel more grounded. You might feel that you have more control in space. The task kind of slows down and all of that. But let's talk about some of the things you're seeing with other types of injuries or prevention techniques. So let's talk about with concussion, because I know there's some research articles out there about training with the strobes and tolerating head impact, right? Because you're, whatever the case may be, but maybe you're able to see in your periphery a little bit better. Maybe you're able to just absorb the hit a little better, whatever the factor is that's making it handle more head trauma or head impact, I should say. And also the other thing would be some of the mental space of things. So how does this training with the strobes or the sensory station help with certain mental states, or like depression, anxiety, and those types of things? Are there any things that you have seen in the past few years about that?
So we'll start with the concussion. Is that there's no proof that obviously wearing the strobes is going to stop concussion. Mm-hmm. The idea was, and the research is really around vision training in general, and it's doing vision training in general and using tools like ours. Obviously, strobe training and the sensory station are really key in this type of work, but those might help you, again, perceive, see the details faster, which then if you're about to receive a hit, you may see it and be able to adjust enough to where you won't have as critical of an impact, right? You'll be able to shift and move. And so that's where the research is coming in, is really about how, when it comes to avoidance and reducing concussion, is really about your vision system is able to pick up those cues and those details earlier, faster. And so then you will react and adjust and hopefully have less concussion. So they were showing that people who did vision training were having less concussions than a control group. And, so there's obviously a lot of context issues, like, what was happening, what type of games, what's going on, that can be blended into that. But the idea makes sense. The theory, the basics of it, if you have better vision reaction and performance, you're probably going to be able to avoid certain things better. Right. The other area that we see is that with our system, it has been used for a lot of different type of rehabilitation areas. So it has been used with concussion, and there's certain protocols that are used that are on the big sensory station. It's about, one, assessing a little bit and seeing where things are at, and so you can track progress and see where you're going. And then also on top of that is the idea of tying in the central and peripheral vision when vision is affected with a concussion. As a concussion can affect cognitive areas, it can affect vestibular areas like balance, those types of areas, and it can affect vision areas as well. Like those are three kind of big spots that you'll see going on. And if your vision is working right, it'll help with balance. It'll help you kind of anchor and use your vision to help you balance better. And also vision training as just an executive function type of tool is going to help cognition generally, right? They show that vision training helps cognitive development. There's even research out on children that is showing that good hand-eye coordination and hand-eye coordination skills help with learning abilities, right? So they tend to be the better academics if you have good hand-eye coordination. It helps with social skills, because now they're reading the situations better and they're picking things up, and cognitive skills as far as like how they're learning, what they're doing, how they're processing information. So we know if you're doing vision training, you're doing it really well. That's why they have vision therapy for a lot of schools, is that it's going to help your function in some way, right? Now, how much and how and exactly how, that's where all the research is coming in and looking at all the time. So we're seeing it with dementia as well. So there's like dementia patients. We're seeing work and research and stuff going on and some positive results with Parkinson's disease, with autism. So some of that helps with focus, with just working on the symptoms of things, like with Parkinson's, for example, it's more a symptom issue and trying to make those better. So there's just a whole realm. If there's, again, if we can make a high functioning, non-injured brain vision system work a little bit better, then we should be able to make someone's who is injured or not functioning at the right level for some reason work a little better as well. And so that's the key. And our ultimate goal is really about we know we're doing performance well. What we really want to do is help injury and function and regular people be better.
Yes, that's a great message. And I like what you touched on there, because I'm a big believer that there might not be a direct relationship to everything, but everything's so interconnected and related to each other that when you improve one area in a positive way, yeah, it's gonna, like how you mentioned in a child, right? If they train vision training, and they might be able to perceive and pick up information better, and it helps them in their social situation. Those are the benefits that we like to see, because it's affecting more than just the visual training task that they're training. It's affecting and translating all into, real lifestyle tasks or life tasks. And I think you're seeing that with the athletes as well, is that when they do this, you're finding all of these other benefits that are a byproduct of just doing or incorporating one part of their training. So I think that's tremendous that, the research is starting to catch up to back that up, and you're seeing it translate into the regular population.